clearing up all the confusion. As soon as the state opened up vaccine signups to Hoosiers 55 and older, plus those actively receiving chemotherapy treatment, so much confusion over the process, eligibility quickly set in. What to do? For example, our Lindy Thaxton, who is fighting colorectal cancer, was one of the first to call 211. She was first told by the person on the phone, they had no idea what she was talking about. They said, call back here shortly. So she called back, they signed her up. Then the health department reached out to Lindy and said, no, you have to go through your healthcare provider for this unique link. So right now she's signed up by calling 211, but she has no idea if she's actually going to be able to get the vaccine that way. Now, to help clear up the confusion and what you're supposed to do, we're joined this morning via Zoom this morning by Dr. Nasser Hanna, an oncologist at IU Health. Doctor, good morning to you.
Morning.
Hey, let's talk about what happened yesterday. Wow, what a lot of confusion. I know that your office was kind of told, hey, this is going to be coming, but it doesn't sound like you guys knew it was going to be yesterday morning. What happened for you guys?
Well, I think things definitely accelerated, and that's a good problem to have, that accelerated a little faster than maybe we had understood. But the process did appear to be a little bit confusing, but hopefully I can clarify things. So healthcare providers, health systems have been asked to provide information on patients who meet these criteria, who are over 16 but less than 55, who have a diagnosis of lung cancer or lymphoma, for instance, those who have any cancer who are on active therapy, to provide that information through a state portal. And then the state would reach out to individuals who meet that criteria by providing them a special link so that they wouldn't go through the same website, that they would have a special link to get into scheduling their vaccine. And so that is the process, and I don't think it was perfectly communicated, but hopefully that will reduce some of the confusion.
Yeah, I've tried to, help remind everyone that this is basically like a breaking news situation. You get a bunch of vaccines and all of a sudden, the government says, okay, how do we figure this out? And we got to get it as quickly as possible. What if somebody, obviously they're being basically told to wait till your healthcare provider reaches out to you to give you the information that, hey, yeah, we're good to go. Have you been able to do that now with all of your patients, or how long will that take, and when should they expect, if they haven't heard something, that maybe they need to reach out and say, hey, am I eligible right now?
Well, the state has reached out to us to provide the information for the patients that are cared for at the Simon Cancer Center. And as you can imagine, that's an incredibly large number of individuals. That's thousands upon thousands of individuals. So we're working on that now to provide that information through the state portal. And again, it'll be the state that does contact the individual. But if you believe that you're eligible for the vaccine based upon the new criteria, and you haven't received anything from the state, any contact, a link, or a special code, I would say in the next 7 days, I would reach out to your healthcare provider, because it's not a perfect system. There may be individuals that are inadvertently missed, and obviously we'll try to minimize that as much as we possibly can. So if you feel like you haven't received a link from the state in, I would say, the next week or so, then I would encourage people to contact their health providers at that time.
Dr. Hanna, I know you are extremely busy. Thank you for saving lives and for giving us important information. So if you would like to listen to anything Dr. Nasser just shared, we'll have his full interview too posted on our website, along with more information there. Again, fox59.com/link.